welcome to Freestyle Connect. My name is Purna Bell. I'm an author and journalist. I'm delighted to be your host. So our theme for this Abbott event is diabetes, my healthcare team and me. We're going to examine the ways in which people living with diabetes and their healthcare teams can create and maintain good relationships and work in partnership for everyone's benefit. Over the next 90 minutes, we are going to hear from a great range of healthcare experts, and you'll also get the chance to quiz them. So please submit your questions in the questions tab, which will be to the right of your screen as we go. And finally, just a quick reminder that we can't share any medical or product questions. And I'm sure everyone on here is an angel, but just to keep things polite in the chat section. So with the first part, we're just going to get going, and to set up our first discussion, we asked Daniel Newman, who lives with type 1 diabetes, and Ken Tate, who lives with type 2, to get together and discuss their healthcare experiences. So let's take a look.
The relationship has been varied, I would say. My transition from paediatric care to adult care wasn't that great. So then I lost interest because I felt, well, if you're not taking an interest, why should I? The healthcare professionals are there to help me, but I have to take some responsibility myself.
So I was seen by an endocrinologist in Edinburgh. When I moved to Bromley in London, I've actually never seen a GP for my diabetes at all. I am probably only seeing a diabetic nurse.
In 2018, I had a kidney transplant. I've had the same nephrologist up until now. And for me, that relationship is great. You go into the room, it's not straight to, you're just viewed as a number or data, you're viewed as a person, and these are things that people can do.
People with type 1 diabetes get a much more expert consultation. So the difference between Edinburgh and London, because I was under an endocrinologist, I could actually basically see a DSN, diabetic specialist nurse, anytime. Even having email addresses, I can even go and see the dietitian anytime.
If I look back on things that I've done, I think it's around education and understanding more about, say, what I'm entitled to. Also, you can go have an agenda. So you might spend 5 minutes before your appointment the day before saying, I want to talk about these 5 things.
I do agree with you, but if you're going to your GP, that you have a list of things that you're talking about, and if you are feeling not great about it, explain why you're not feeling great about it, so that they can actually understand what you're going through, because they don't know you. People like myself and type 2 who are take insulin, we tend not to get the tech because of various criteria that we don't meet. Even when your healthcare professionals actually says you require it, that you can't actually get it.
What I see in the community is people having challenges around access to, say, insulin pumps. According to the data, their management is where it needs to be. What about if you want to do better?
When I read and see type 1s that are actually doing well with their diabetes don't get the tech, I think, really? There are times that you probably don't know you're actually not doing well. Having the technology around, especially the labourer, it gives you that confidence that what you're actually doing is right. In 2020, I self-funded for 4 months as a labourer, and I found it very intuitive in allowing me to see what was actually happening with diabetes. If you don't have it, you don't really understand what's going on in your body. So to me, technology is a must. would allow my healthcare professional, my GPs and diabetic nurses at the time, to understand what was actually happening on a daily basis, rather than just what HbA1c says over 3 months, which doesn't tell you the whole story at all.
It's more talking about it as a whole and what's happening here. And also, I feel empowered as well, because I'm able to have better conversations.
When I did show it to my GP, who had never seen it before, she was totally amazed at what was actually happening. But it gave her another insight of what's actually going on.
Yeah.
And I think that is important to a healthcare professional, because then they can relate better to you.
You do feel empowered. You know that data has helped you to make a better decision.
The healthcare professional tries to understand you, what your lifestyle is about, what you're doing, what your knowledge is of your disease. Work together in managing the disease and not having one person tell all.
There's a level of knowledge that they have about certain areas of the condition that I don't have. And that's where their knowledge and my lived experience, or our lived experience, should come together. That enables us to have better conversations.
Once you have the knowledge and understand your own diabetes and how it works with you, you can actually work on a much more partnership level. In my own profession, I know that it takes a while for you to actually open up about something. So having that working partnership allows you to give you that opportunity to open up to a healthcare professional about various problems that you may be having.
Just when it comes to that openness part, just remember that you do have options. If you are, say, living with type 1 diabetes, you might decide to transfer your care from the hospital that you're at to another hospital. If perhaps it's not working the way you would like it to work and you've tried everything, then that is another option to consider.
So you need somebody that you can relate to as empathetic to you, to be congruent with you and everything else, so that you can actually move forward.
And now psychologist Professor Deborah Christie has given us some insights into how appointments are from a healthcare professional's perspective. This includes some pointers, some questions for us to consider as patients as to how we can make these appointments a positive experience.
As a healthcare professional, I can tell you we're supposed to know stuff. We're supposed to have answers. We're supposed to be there to help you and support you and give you the best care we can. That's our job description. But the theory of what should happen and what actually happens in the real world sometimes just doesn't match.
It does give that other perspective that we probably don't think about all the time.
There are valid points to that, and understanding that your healthcare professional is human as well, and they are bringing that to the consultation.
When we feel we're failing to support you, we get burnout too. This can lead us to unconsciously blame you, the person living with diabetes. An unconscious voice says it must be something the patient's doing rather than my advice being wrong. How can that be? And that belief influences our story about you, about diabetes, about ourselves, and makes us question whether we are a capable healthcare professional.
They're not actually all the font of all the knowledge, which is interesting because we expect them to be the font of all knowledge.
That conversation shouldn't be challenging.
No.
It should be easier to say, if they don't know and they say, oh, I don't know, but I can get back to you, that's fine. Yeah, when it works well, it's an equal understanding of both sides.
Thank you so much to Daniel and Ken for sharing their experiences, and to Professor Deborah Christie for her insights. And I think that's such a lovely way of thinking about things, as in how you combine lived-in experience and, you know, professional expertise as well. And I think that that's something we'll be uncovering through the rest of the event. Also, just to remind you that we are running a series of polls throughout the discussion and throughout the event, and we would love to get you involved. So if you click on the poll tab, which should be to the right of your screen, you'll be able to interact there. And also, we would love to have your questions that are coming in for our guests that we will be having our discussions with. So please do make sure that you put them in the questions tab. So I'd like to welcome our first guests. We've got consultant diabetologist, Dr. Emma Wilmot, and we've got content creator, Jasmine Jafar, who lives with type 1 diabetes. Welcome to both of you today.
Yeah,
Well,
thank you very much for having us.
I think we're just going to wait just a moment to get Jasmine on screen. So hopefully we'll be able to do that. But Emma, I just wanted to ask you what your reaction was to the video in terms of from your vast experience as a healthcare professional. Like, did any of that kind of ring true to you in terms of, for example, what Deborah Christie was saying?
Yeah, no, completely. And I think a lot of those comments are really quite hard hitting. And for me, some of the key things that came out were really about how important that healthcare professional relationship with the person with diabetes really is. It's absolutely critical to be able to have trust, confidence, to be able to speak on the same level, and to build continuity of care and confidence in each other. And I think, it actually made me feel really sad when Dan talked about the fact that the healthcare professional that supported him earlier in his time with diabetes didn't have an interest in him. I felt that was really sad that he's had that experience. But I imagine he's probably not the only person that's had that experience, but he's absolutely right. Why should he take an interest in his diabetes if he doesn't feel that his healthcare team do either? And so that was really hard hitting. And then for Ken, the key thing for me which came out there was around access to technologies. And I'm sure we'll get absolutely loads of questions on this. And I share the frustration, realistically, I personally believe that 10 years from now, nobody will be finger pricking to check their glucose levels. We have the technology to make it easier. And I think we're in a transition phase of moving away from blood to continuous glucose monitoring. And it's just, happening slowly as the research, etc., builds. I think we'll eventually get there, but the next few years are without a doubt going to be frustrating when we've got access for some and not others.
Thank you. I'm going to have a lot of other questions for you as well, but I just wanted to welcome you, Jasmine. Thank you for joining us. Little technology gremlins, but you're here.
I'm so sorry.
No, don't worry at all. So I would just like to ask you the same question, really, about, I would assume that there would have been things that Ken and Daniel would have been talking about that would have resonated with you. Did you see any of your own experience in that?
I did so many through both of their experiences. I think one of the things that Dan first mentioned was the difference in like care as a child versus an adult, and like that transition and finding your space within healthcare professionals as you grow older and learning to advocate for yourself. And also what Ken touched on in the sense that holistic care is so important. I think building a positive relationship with your healthcare professional also stems when they care about you, not just as a diabetic, but also as a person, and they take into consideration your lifestyle and your personality. And I've found that the more my healthcare professionals do that, the closer our connection is, and the more like safe I feel, and the better the relationship is, rather than just feeling like a number that they tick off at the end of the day.
Thank you. I mean, I've got another question just off the back of that before I move on to you, Emma. We've had a question that's come in from a viewer who said that, all too often they feel like it's just them dealing with their diabetes on their own. I mean, do you have any advice around that or any viewpoints around that?
I really understand that feeling. I think the very nature of diabetes, or type 1 diabetes from my own experience, being like an autoimmune condition and so autonomous, you deal with so much of it on your own. And especially as an adult, like I might see my healthcare team once a year. I'd like to see them more often, but with availability and resources, you don't often get to, you don't get that chance much. So it is so normal to feel like it's just you dealing with your diabetes. But what I found really helps me is being able to connect to community. So, I'm very active on social media because of that. I've been able to connect to so many diabetics online, and that really helps me learn so much more about my diabetes and connecting with other diabetics, you realize you're not the only one. Even though sometimes you can be like, I'm the only person experiencing this, but when you connect and speak to other diabetics, you're not. And also bringing up those feelings and emotions when I do get to speak to my healthcare team is very helpful, because then that also gives them insight into where I'm at mentally, and hopefully encourages a more mutual supportive relationship in that sense as well. So it's normal, but we all feel that way, and hopefully there can be some comfort in that as well.
Do you find that looking at things from a sort of healthcare aspect, that when you are able to tap into that community, that can be a helpful thing? Like, has that been sort of a positive influence in terms of just knowing how to navigate your healthcare as well?
Yes, so much, because I think one of the things that can happen if you don't tap into community is like you don't know what you don't know. I've learned so many things off social media that I've then been able to go back and speak to my healthcare professionals about, or be able to ask questions, or even the existence of like a half unit insulin pen I wouldn't have known if it wasn't for Instagram. And or I've also had another experience where I didn't know that there was different needle sizes, and I just kept on bruising on my stomach, and I saw that online people had smaller needle sizes, and I was like, oh my gosh, maybe smaller needle sizes exist. And I brought it up to a healthcare professional, and they're like, oh yeah, we can, because I was using 8 millimeters and now I'm on 4 millimeters. So little things where you get empowered by the knowledge out there, and you're then able to bring that back. And of course some things you take with a pinch of salt, but the more knowledge you have, the more empowered you're going to be, and the more options you're going to have on how you want to manage your diabetes and what's available to you.
Thank you. And that actually moves me quite nicely onto a question I wanted to ask you, Emma, which was, very often I think sometimes people don't know or don't feel empowered to, let's say, prepare, right, for their appointments when they're about to like go in to see a doctor. And there is definitely some frustration about how hard it is to get that appointment in the first place. So sorry to lay this double whammy on you. There are kind of two parts to this question. So we've had a question that's come in from a viewer who said, that they found what you said was very helpful, but what happens when, for example, you can't get an appointment with your doctor, or you're quite frustrated about being able to have that contact with your healthcare team? And then I'll ask you the second question after that.
That's very kind. Yeah, no, I think there's absolutely no doubt across the whole NHS, services are stretched. There aren't enough doctors and nurses in the NHS to deliver the level of care that we would all want and expect. But I think the key thing is having the contact details, not just of how to get in with the doctor, but nurses, dietitians, practice nurses, all work and support people with diabetes. So I guess it's reaching out and making sure you've got some contact with the team to make sure that your concerns are addressed. But I completely share that frustration. As a healthcare professional, I want to be seeing people far more often than I do. And I feel just as frustrated as people with diabetes do that I cannot see people more frequently than I do. This is just the reality of the health service that we live in. There aren't enough doctors and enough nurses, never mind in diabetes, but wider, in general practice, etc., across the board. So very much share the frustrations.
Yeah, and I completely feel you on that. I think that when you then do get that appointment, there's just so much pressure on what comes out of that appointment, right? And so I will ask you a bit more about something that Professor Christie touched upon, which is the burnout that's kind of felt on both sides. But I just wanted to ask, do you have any sort of tips or any advice for people on how they can prepare for when they do have that appointment?
Yeah, so I actually have experienced both sides of the coin. I'm a diabetes specialist, but I also live with diabetes. So I've been that person sitting in the waiting room with my heart beating in my chest thinking, oh, what are they going to tell me to do? I'm absolutely terrified. This is a horrible experience. And now I am that doctor that people are coming into. So I do my best to try and put people at ease, because I know just how horrible it is coming into that. And I think unlike other long-term conditions with diabetes, it's so easy to judge the person with diabetes for their outcomes. If somebody's got asthma and their asthma is not well controlled, they don't get into trouble for having poorly controlled asthma, but that does happen in diabetes, and it absolutely should not. And what I say to a lot of my patients is, you're living with an untamable beast. There is nobody that I see in my clinic that has their glucose in range all of the time, regardless of what they're doing. And all you can do is continue to try and tame that beast, but it will continue to do what it likes. And you're just going to be going backwards and forwards in this, and it's exhausting, and I completely get that. But in terms of coming in and preparing for the appointment, I think, think ahead. During the pandemic, for example, a lot of our appointments switched to telephone, and I found that a lot of people, you'd be catching them and they'd be in the middle of work and they hadn't had time to think about the appointment. And I don't think either myself or the person with diabetes got as much out of that. I think taking the time to think, actually, this is your safe space to talk about your diabetes and how it's impacting on your life. Think about it. What's important to you? What's bugging you? What are your where are you just now? Where do you want to get to? What changes, if any, are you willing to make at this point? And I think as a healthcare professional, what's really important is when that person comes into the room, that we create a safe space for them to be able to just launch at us with everything that's on their mind at the time. And if the healthcare professional is not giving you time to do that, then they're doing you injustice, because that first 5 minutes when you go into the room is your chance to really communicate everything that's concerning you. But and actually, not many people do this, but write down a list, bring it with you, because it's so easy to be lost in the moment. Diabetes permeates every aspect of life. So plan ahead, write down a list, bring it in, and make sure that you get the most out of that consultation. And actually, coming back to the video and what they were talking about, if you don't get on with your healthcare professional, switch. It's two personalities having a conversation. And if it's not working for you, that does not have to be the care that you have for the rest of your life. Have a quiet word with one of the healthcare professionals you might have a better relationship with, and ask to see somebody else. We won't be offended.
Yeah. That's such good advice. Also, because I think people, because of the way the NHS is at the moment, and also what barriers there might be to accessing healthcare, is I think that people are just scared to do that, in case that means that already inhibits what is already quite a challenging access to healthcare. So it's really good to know that is a possibility. We've got just under 10 minutes to go. So it's just to say to anyone who is watching, please do feel free to use the polls or take part in the poll questions that are to the right of the screen. If you've got any other questions for Jasmine and Emma, please do let me know, but I'm just going to work through the ones that we've got at the moment. So Jasmine, I'm just going to move on to you, because you're obviously on the other side of this. When you have had those interactions with healthcare professionals, what have you found makes you feel like you've had a good result out of it? Or what are some of the things that you put in place to make sure that you come away from that feeling good about it?
Yes. Okay. So one thing I like to do, I love to prepare for my appointments. And I am one of those people that walks in with like a list of stuff that I want to touch on. And as silly as the question might be, it's always the case where you make a mental note that you want to ask something. And before you know it, you're leaving the hospital and you're like, oh my gosh, I forgot it. And it's such a trek again to get back in touch with your consultant. So I definitely make a list. And even if it's just, silly questions, I like to make sure I touch base on all of them. And something that makes it feel positive or successful, I think in the past I found myself in situations where a consultant might focus on the fact that I was like at 14 on a Tuesday at 5 p.m. and they'll be like, why was your blood glucose at 14? And it can feel very like tunnel visioned, and you just feel a bit like overwhelmed. It's like, I can't remember why I was at 14 a month ago. And then, like Emma was saying, you can feel a bit of that frustration, and it's not very solution oriented. It's kind of like looking back at things you could have done, like things that went wrong, rather than being like, okay, so if you went to 14, like what are your steps in place that you have to manage your high blood sugars or things like that. So I find it very beneficial. Well, one, having my Libre data, my Freestyle Libre data has helped so much, because then they're able to see like patterns and trends. And the more that I use it, the more that it benefits them in my management in being able to, I have an alarm, sorry, in being able to give me insights and guidance. So the kind of more committed I am to my health and my management, I think that really makes it helpful as well. But then also when we go in looking at things holistically and not necessarily focusing on the tiny details that would make me feel overwhelmed, but just touching base on my management plan and how I'm feeling. And I've also found it really successful visits when we also sit down, and I know sometimes it can be hard if there's a time constraint, but when the conversation's also about how I'm doing as a person, and touching base on my life and where I'm at with like stress or happiness or other parts of my health. Because it wasn't, even as a woman who experiences a cycle, it was only like a couple years ago, and I've had lived with type 1 diabetes for over 13 years, where my cycle even came up in an appointment with a consultant, and that has a big impact on glucose levels. So when I feel like the care is holistic, I can then walk away and feel like I've got an action plan, and I feel more empowered rather than like feeling judged or in trouble for certain things. I just want it to feel very empowering.
Yeah, that's so useful, and that's also something that has kind of come through, right? In terms of it's all about tone and nuance, because if you feel like you have to go on the defensive and the doctor that you're speaking to is asking because they're just confused and they want to know what they can do about it and feel stressed about what they can do about it, it sort of then just creates this like endless kind of cycle. So it's about, I guess, breaking that cycle and actually breaking those conversations down so that you're two human beings who are talking to each other, who have two different experiences, and it's about how you unify to actually have one unified result. So Emma, I've got a couple of questions that have just come through for you, and insofar as you can answer them, there is one that's come through about a general frustration about when they have had interactions with, let's say, going into hospital, that they've said almost all nurses and doctors don't know much about diabetes. I'm going to assume that these aren't people who are specialists in diabetes. Do you have any thoughts on that, or how joined up people are in the health service around knowing about different areas of healthcare?
Yeah, so this is something else we share frustration with. It is I mean, if you think about how quickly diabetes management has evolved in the last decade, it's unbelievable. You know, the glucose monitor, closed loop systems, all the different drugs for type 2 diabetes. And it's, a lot for us as diabetes specialists to keep on top of, but actually if you don't work in diabetes, trying to get your head around all of those developments is really challenging. And a lot of people, when they come into hospital as an inpatient, are worried about the fact that healthcare professionals don't know as much about type 1 diabetes as they want them to. And there are national campaigns and work going on around this to upskill healthcare professionals, to ensure that people are supported to self-manage their diabetes in hospital, things like not having their insulin taken away from them and being able to do things as they would and leaving them in control. It's, again, still not perfect, but all the national organisations are very much aware of these issues and are continuing to push to improve things. So watch this space, but again, I share the frustrations there.
I've got one very quick question because I'm just a bit conscious of time, Emma. So there's someone who said that they haven't had a face-to-face with their diabetic nurse, community nurse, GP surgery, diabetic specialist. What can they do to be able to get the help that they need?
So I guess the key thing is, if you're not being seen at all, is just push. Don't feel embarrassed to ask for help. If you're usually seen in your GP practice, phone up the receptionist, say you've not been seen, and just really push to get the appointment. If you're under secondary care and you've got a consultant, you can go through switchboard, ask to speak to their secretary, and just explain the situation. I think the reality is, up and down the country, the hospitals are at different stages of recovering from the pandemic still, and there are different issues in different hospitals, but ask, push, and hopefully you will get seen.
We might have time for just one very sneaky quick question. Jasmine, someone said my diabetes consultations are currently done online with one of the consultants at my local hospital, and they use the info that I input into my Freestyle Libre as the basis as to how my appointment flows. Is that the same for you? It's got to be such a quick answer. Sorry.
No, that's okay. Yes, it follows that as well. And I just want to add something on what Emma just said, like the power of advocating for yourself. Keep calling up, email. Like there's times where I email the diabetes nurses at the clinic and be like, I haven't seen anyone, and following up, like not being afraid to make your presence known, and of course understanding like the constraints on capacity and resources. But you won't ever be able to see anyone if you're not doing the following up yourself and pushing your case. It's so important to have the confidence to advocate for yourself, and even taking that confidence into those appointments can really help your management.
Thank you so much to both of you. And Jasmine, I love like everything that you do on TikTok around just making it so clear to people about, if they're going through the same thing. And thank you for now to Emma, because you'll be back later to take more of your questions. So if some of you feel like we didn't get to all of them, don't worry, there's an opportunity later on. So I'd like to turn to the more wider areas of support that are available to people who are living with diabetes. So before we meet the panel, we asked 5 people living with diabetes to tell us about a turning point in their healthcare experience and what advice they would give to professionals about speaking to people living with diabetes.
We were looking at my overall sugar profile on the Freestyle Libre 2 Systems graphs, and we noticed I was having a spike every single night after going to bed. After speaking to my nutritionist, we were able to fathom that that spike was due to a scone I was having every single night before bed. That scone was full of jam, full of cream, full of berries, all the good stuff, but also all the sweet stuff. My nutritionist suggested I should avoid those foods before bed, and that made me think more in general about what foods were right for me at the right time and how I savour scones for special occasions or as desserts at restaurants, but certainly not every night before bed.
For 12 of the last 15 years, I only saw a GP occasionally. I saw the practice nurse maybe once a year for the routine annual review. I had an HbA1c test about once a year, and that was about it, regardless of what was happening with my actual diabetes control. I actually saw a consultant in diabetes for the first time just 6 months ago, and I've seen him, I think, twice over the last 6 months. Now I see a specialist nurse that I've managed to build a relationship with every couple of months. I can contact her via the phone and via email. And for the very first time, I feel as if I'm not entirely on my own trying to sort this out.
Something that really worked for me and my healthcare team was linking them in with my Freestyle Libre system. The diabetic nurses and doctors were able to see my graphs through, read my glucose levels, and read detailed notes that I had input into my system. This gave a true image of my daily life, and it really helped us to gauge and make adjustments to my insulin ratios.
I always remember when I had an appointment with my ophthalmologist at the time, who told me that my background diabetic retinopathy had become maculopathy and it was getting slightly worse. And for me, that was a huge turning point with regards to my mindset around my diabetes control, my mindset around my diabetes. And to be honest, it gave me the boost of motivation that I needed to really hit the ground running and take control of my type 1 diabetes.
The Libre system has had a huge impact on my ability to control my diabetes. I went from an A1C of 74 to 49 in 3 months just by using Libre to analyse the effect of all food. And it put me on a low-carb diet, and I haven't looked back since. It has absolutely changed my relationship with my diabetes and with my body.
I would say that it's important to remember people with diabetes don't necessarily have to avoid eating certain foods. However, some of us may choose to because it's a better way for us to manage our condition. However, it's important to make sure that all of us have a well-rounded knowledge of nutrition, because there may be situations, for example, going to the cinema with you and your friend where you order 2 large popcorns and then you're the one that eats them both, if you're like me. And it's important to just have that knowledge of how you deal with those sorts of situations, how you would adjust your insulin dosage, how you would change your management plan, and just making sure that those foods then don't have as much of an impact on your sugars as they would if you weren't as informed by your healthcare professional.
My main advice to nutritionists and healthcare professionals would be that there isn't really a one-size-fits-all diet. The diabetics are all different, and different diets work best for different people. In my own case, the standard nutrition advice just doesn't work. Whereas switching to a low carb, which is considered by some a novel approach, works extremely well. So yeah, just remember we're all different.
Inevitably, the health service is designed around protocols and the notion of the generic patient. And that leaves me feeling quite frustrated and a little bit at risk, because I'm the person in the relationship with the most information about what's happening now, what happened in the past, what medications I've taken. The other issue that is inevitable in the NHS is that my doctor and my nurse don't have the time and don't have the resource to focus on the individual patient. And this really is a problem when patients have multiple long-term conditions.
You know, sometimes our glucose levels are going to go up and down based on things that are completely out of our control. It doesn't mean that we're not trying. So yeah, if I was to kind of give any advice, it's just to know that, you know, we are trying, and it's not easy, and it is like a full-time job. But again, as long as we're trying our best, that is the main thing.
Thank you so much to Johnny, Stephen, Mariad, Mark and Vanessa for sharing their thoughts. Just a reminder to keep taking part in the polls that are on the right-hand side of your screen. And as we enter into our second discussion, if you have any questions, then please do put them in the questions box. So to begin our second discussion, I'm joined now by consultant diabetologist Professor Ramzi Ajan, Mark Green, a diabetes specialist dietitian who has been part of our events before, psychologist Dr. Rose Stewart, Daniel Newman, who is a diabetes advocate who you remember from the first video that we watched at the start of the event. So welcome, everybody. And I think we're just waiting for Daniel, but I actually might kick off, Professor Ajan, with you, if that's okay. Because especially the video that we've just watched, it sort of seems to be a common theme that when we're talking about healthcare and we're talking about people that that have diabetes, whether it's type 1 or type 2, it's a sort of theme of judgment, of sort of feeling when they go to see their healthcare professional that there is sometimes in certain scenarios that they're made to feel as if the results aren't what they should be, it's something that they've done wrong, without taking maybe a more holistic approach to what else might be going on. And, you know, Jasmine sort of said in the previous part about, you know, for example, the impact a woman's menstrual cycle might have on her glucose levels and so on. Do you have any thoughts around that?
No, absolutely. I think everything that is mentioned is incredibly important. Let me start with the first thing, that we are different. So each person has different needs, and this is something that we are not always good at because of the pressures we are under. So that is a point very well taken, and it's important. It's important for the patient to point out that, look, my needs could be different. The second thing is the knowledge. So sometimes you are not very good at educating people, and I think that's important. And one thing I always try to avoid is to give too much information out at one go. So it's a stepwise approach, and this is why it's really important to have that continuity of care. And I'm absolutely delighted to hear that that is coming up again and again and again. So that's really important. The issue that was mentioned, not sort of one size doesn't fit all. Again, that's part of the management, that we are different people. And I take the last point very, very seriously, is that sometimes people try very hard, but the control is not perfect. And yes, it's important to try. Well, I always say that we work as a team. So the healthcare professional and the patient is a team. It's an unfair team. I always say that, because the patient is doing 99.9% of the work and we end up doing 0.1%. But it's important that we understand each other and we help each other out. So I think all those points are very well taken, and I was delighted to hear them.
Thank you very much. And I'm sure that we will have some more questions for you later on. And if you have any questions, for those of you watching, please do pop them into the questions box. Daniel, I just wanted to go to you really quickly. Also, off the back of the video that we saw, but also something that that Jasmine finished on actually in the last session, which was about advocating for yourself. You know, when you are in that scenario where you've got whatever level of contact it is with your healthcare professional, now. Do you have any advice for people on how you can advocate for yourself, or just something that has worked for you maybe in the past?
Yeah, so for me, in the past I wasn't very good at advocating for myself. I really felt that there was a power dynamic in that relationship, and my consultant had all the power and knowledge, and I didn't have much. But over the years, I've managed. It's down to me understanding more about type 1, having more knowledge about the condition, and then feeling empowered to make better decisions as well. And I think that if you do find yourself in a situation where you, as Jasmine mentioned, you're not getting the best out of your appointment, it's okay to leave that appointment and then find another way to contact your consultant or your nurse afterwards if you do think of something. But a lot of the onus is on us as people living with type 1 to look up to empower ourselves to make those decisions. So for me, it's about knowledge, building that knowledge base, and then when you go to the appointments, as I think Emily mentioned, have a list, just be prepared, and that's really what helped me to go from not feeling empowered to feeling empowered.
Thank you. Very, very quickly, very quick question off the back of that. You know, when you said you didn't feel very empowered at the beginning of things, was that to do with how you felt within yourself, or was that to do with your specific consultant, or both?
I would say both. I think how I felt within myself in terms of my management of my type 1 at the time. I think also culturally, so I'm from an African Caribbean background, and culturally we view the healthcare professional as having the font of all knowledge. They know everything and you don't really question them at all. But actually you do need to question sometimes, or really advocate for yourself to get the best care that you need. So I had that going on as well. And also, if you feel that you can't speak to your healthcare professional, you can just feel, what's the point? But that's also again on you as an individual to overcome that part of what's the point, because it's your health. And Vanessa touched on complications being a turning point for her, and that was what happened for me as well.
Great, thank you. Rose, I would like to move on to you actually off the back of what Daniel was saying. Do you have any tips or advice on how to deal with a potentially challenging or tense situation in appointments if you are the patient?
Yeah, it's a difficult issue, and it's really sad to hear that so many people have had these negative experiences. And I think it's really important to remember as well that a lot of those negative experiences, especially if these were experiences when you were a kid, for example, which lots of people with type 1 might have had an experience of many appointments over the years, that when those negative appointments happen, they can almost set up those expectations for the ones going forward. So you can be anxious before you even get through the door. You can be anxious the minute that letter arrives on your doormat. So it's worth bearing in mind sometimes that if you know that these appointments make you very anxious, trying to do your best before you get there to put that relaxation into place so that you can go through the door in the best possible mind frame. Because we know that when people go into appointments anxious, they're less likely to take in information. They're more likely to pick up on bits of feedback that may not be designed to be critical or negative, but they're more likely to feel negative. It's really important, like Daniel was saying, that people try and communicate as much as they can with healthcare professionals around you, especially if you've had previous negative experiences. Now, if you don't feel in a position where you can do that yourself, you do have the right to bring other people into appointments with you. So if you don't feel that you can raise these issues yourself, maybe asking a friend or a partner to come in with you, that can be really useful. And as Daniel was saying right back in the beginning, you do have the right to switch diabetes consultants and diabetes teams if you need to. If you feel that that relationship has broken down, nobody should come out of clinic feeling worse than when they went in. And although sometimes I've certainly been in the situation myself where we're in a clinic appointment where we've had to have really difficult discussions about how someone's doing with their and how things need to change. Those sorts of appointments should always have a plan at the end of them. So even if you feel like things are really not in a great place with your diabetes, you should feel that you're working with your diabetes team, that you feel supported by them, and that you've got a plan coming out of it. If you don't feel like those things are happening, then that's a discussion that you do need to have with your team. I wish I could get all people with diabetes to get involved in things like patient reference groups and these feedback panels, because they really do make a big difference. So I'd really encourage people to advocate wherever you can.
Thank you. I have one very quick question for you before I move on to Mark, but also just to say, for anyone who's watching, we're sort of just over about halfway through. So if you have any questions, now's your time to ask them in the questions box. But Rose, just very quickly off the back of that, because again, this has been like quite a common theme that's kind of come through, which is, it's not to say that, you know, the responsibility should be on the patient to have to handle everything and do everything perfectly, right? Because that's, you know, both parties in there, and particularly so for the healthcare professional that they're dealing with. But if you are the patient that is going into a scenario like that, and you may, for example, be anxious, or let's say you've just had bad experiences in the past, and you are having a conversation where, for example, you can feel yourself getting quite defensive, maybe because of how the question is being phrased, or, you know, there's been a particular result that hasn't been so great. Do you have any like suggestions around coping mechanisms for when you are directly like in that situation, to just sort of be able to kind of just take a moment and take a breath so that you can get the most that you want out of your appointment?
Yeah, it's a really tricky one, because often feelings like anxiety come up really, really quickly, often before you've even realized what's happened. So what could really help, I think, for a lot of the time is firstly to be aware of your own experience. So try and check in with yourself, notice those feelings as they come up. So if you notice there's that feeling of anxiety, name it in your own head, but also feel free to name it in the room. So if you notice that you're feeling panicky, that you're feeling anxious, that what was said has made you feel really uncomfortable, name it. Because I think a lot of the time as healthcare professionals, we can be guilty of not tuning in to how somebody's doing emotionally, that we can have our own agenda, we've got our own discussions, our own questions that we need to get through. So naming it is really helpful. Then just moving around a bit, linking in with your body and having that emotional grounding can really help, because sometimes when we get anxious, we go off into our own heads a little bit. So coming back into your body, notice your breathing, notice the chair that you're sitting on, and then tuning back into what's going on in the room. So it's a technique that we call dropping anchor. So if people want to Google dropping anchor from acceptance and commitment therapy, it's a really good thing. You can do it within 30 seconds, and it just really helps you to bring that anxiety down and bring your attention back into the room where it needs to be.
Amazing, thank you. And Mark, I'm so sorry I have taken so long to get to you, but here we are. I know that you're going to have some really good stuff to say about this. I mean, no pressure, but do you have any advice for people on how to think about and prepare for meetings specifically with a dietitian?
I mean, I think everyone dreads seeing the dietitian, and I think there's this perception, and maybe it's born out of how appointments used to be in the past, or maybe you've had a bad experience. But I think people feel like they're going to be told off, and we're going to just tell you what to do. No, you're doing it all wrong. This is how you need to do it. And actually, that's not how I approach it at all. My role is purely to facilitate, support, and try to empower people, give them the strategies about how to think about their diet, their goals, whether it's weight loss, diabetes management, insulin adjustment strategies, so they can recognize when situations arise, how to deal with them. So for me, a big part of what I've sought out, and if there's any healthcare workers watching this, I couldn't recommend enough things like behavior change training, motivational interviewing, because a lot of it's about how to structure the appointment and the types of questions you ask, putting it back onto the patient, asking lots of questions. What do you want to get out of the appointment? Don't just tell people what to do, ask permission. would it be useful if I offered a suggestion? If they say no, don't offer a suggestion. If they say yes, then you have the permission, and you start to forge those relationships. And I often say to patients, especially in those first couple of appointments, it's arrogant of me to assume that I can come in and fix this lifelong condition for a lot of people in 2 appointments. So it's a journey, it's a process. So we're in this together, and it's as much about you as it is about me. So I'm here to prod and probe and ask questions. Sorry if it feels like an interrogation, but ultimately I'm just here to support you.
Thank you so much. We've had a question that's just come in for you, but I'm just going to go to Professor Ajan just really quick before that. How important is it? How important is the quality of the interaction between people who have diabetes and their healthcare team? And by that, I mean, can it have a physical impact on their day-to-day diabetes management? So if that quality is good, for example, is that something you've seen?
So on a scale of 1 to 10, as 10 being very important, I would say 100. Because the and we had that word quite a few times, the positive interaction. I think positive interaction is very important. And you need to show that you understand the difficulties that a person with diabetes is going through. And this is how you develop that relationship, and this is how you can help that person. Because, I mean, quite frankly, diabetes is a highly complex condition. And sometimes we try to oversimplify it when, again, we heard quite a few times that this is a full-time job, and it is a full-time job most of the time. So I think this positive relationship is very important, and this is why continuity of care is very important.
Thank you for that. I mean, we've had another question that's come in, which is around the differences, for example, that you might need to have between the type of healthcare professional that you're seeing. So would you say that there are differences, for example, between if someone has diabetes, how they might need to prepare for a meeting with a specialist team in a hospital setting, let's say compared to routine interviews that they might have with their GP or nurse?
Yes, I would say so, because, and I mean, one thing that I ask my patient is to, 2 things actually I do. I ask them to prepare a list of things, write it down. If they have a question, write it down. And then if they have a burning question that can't wait, email me. I'm there. They can email me directly. And, sometimes it's a very quick question, and then it's out of the way, and they feel reassured and they feel safe. Again, it's a word safety that we heard earlier. They feel safe. So I think to prepare for it is, people need to have their own concerns. They need to come out with their own concerns. It's always nice to prepare a list of problems. And quite often the main concern comes out at the end of the consultation. We talk about a lot of things, and then at the end, numerous times I say, there's something that you haven't told me. What is it? And then the patient comes out with it. So I think having that relationship with the doctor, and not only the doctor, of course, the whole team, because, to look after a person with diabetes, you need the nurse, you need the doctor, you need a psychologist. In our clinic, we do have a psychologist, the dietitian. So it's a teamwork, and they need to have those questions for the team prepared and not be afraid of asking those questions, because it is their health at the end of the day. And I always tell my patients, I'm actually working for you. You're the boss. I'm just working for you to move things forward.
Thank you. Daniel, to ask you a question off the back of that, when you're in, a setting, whether it's with a GP or a specialist, like, do you notice a difference in terms of how comfortable you feel talking about what you need and what you want?
Yeah, so I think now in either setting, I'm comfortable advocating for my needs. Definitely if I'm in a GP setting, I know that I will probably have to explain more about type 1 diabetes or certain parts of the condition than if I'm seeing my specialist team, just purely around to knowledge that the professional has specifically around the condition. So yeah, I do notice the difference, but I'm comfortable advocating for my needs definitely now.
Thank you. We've got a question for the whole panel, so I will I'll go around everyone to ask you this. And also just to say to anyone who is watching, if we don't end up getting to your question in this particular segment, you will be able to ask as many questions as you like in the next one. But is there any advice on making the appointment flow better and connect with the consultant in a short space of time? Rather than, let's say, feeling like it's a sort of a tick box exercise. Professor John, I might start with you first about that.
Yeah, I mean, I think the trick is that, I mean, the healthcare professionals should ask the person, how are you in general, right? And then the person with diabetes can start with the most pressing problem. So the consultation should be really directed by the person with diabetes. And then, of course, I mean, the healthcare professional will be talking about some other issues that perhaps the patient did not notice or did not know about. But I think it's very important to direct the consultation and be part of it rather than just being a machine that answers the questions, but be part. And this is where I always say we work as a team. The doctor, the nurse, and the patient, they're part of a big team and they should be working together. So that would be my view.
Thank you. Rose, do you have anything that you would like to add to that?
Well, I think a lot of the onus needs to be on the diabetes team. It's not the person with diabetes' role to make the appointment flow well. But yeah, I think in terms of things that the diabetes teams could do to make appointments more effective, I think trying to take out admin, so doing things like screening measures beforehand, using things like performance for clinics so that you can get a lot of that boring paperwork out of the way and actually have the time to spend with the person with diabetes. And making sure you know about that person's life, whether it's understanding where they work, the demands of that, their family, to even knowing their football team, because there is a lot of mileage in being able to take the mick out of various people's football teams.
Thank you. Daniel, I'm just going to move on to you before moving on to the next question, if that's okay. But have you, when you know that you don't have a lot of time, is there anything that you know that you want to do, or any advice for anyone watching this on how to make the most out of that short space of time?
I think the key thing is preparing for the appointment. And I probably can't emphasize that enough. It's just knowing what you want to get out of that appointment. And I think many people have mentioned it already, but just having a list, but if you prioritize it in your mind, what you would like, and make sure that's either point number 1 or number 2 on the list, then that's key. And I would also just say briefly that I think for me, and what's really important for people living with diabetes when you go into appointment, is that you're seen as a human by your healthcare professional, and not just numbers, and not just a data generating person, that you're a real human with emotions who is living with a chronic condition. And that goes such a long way, because then you connect on that human level, and that builds that trust that everyone has mentioned so far. And when I've just been seen as somebody who generates data, that's when I've not connected. When I'm seen as a human, that makes such a big difference to me, and I'm sure to everyone as well.
Yeah, and I think that is actually such a good way to segue onto the next question, which I will open up to our other 3 panelists, which is, question has come in, which says, is there a danger that healthcare professionals can focus too much on the numbers in the data rather than the difficulty and the strife behind achieving those apparently good results? And Mark, I'm going to go to you, because I know that you sort of touched upon this in terms of people being really nervous when it comes to talking to a dietitian about this. What's your view around this?
You know, I think also it comes down to the individual healthcare practitioner. Just like everyone, there's different personalities, and unfortunately, some people just focus on the numbers, and they might not even have necessarily those social skills to just sit down and think, breathe. How are you? How's things? How's this going? They're straight into the consultation, and you know, I've sat in on those consultations, and it makes you kind of creep up a little bit on yourself. and it's a little painful to see. And I really sympathise with patients that have had to go through that. And I think where us as healthcare professionals really need to up our game as a whole is making sure that we are having those skills for counselling, and as I say, motivational interviewing and everything that comes with that. So it is a challenge, and I do appreciate it from the patient side. I suppose the flip side is we are there to do a job and actually try and help these people with the specific thing that they've come in to see us for. But obviously, sometimes if you just get a letter in the post, especially with the dietitians, half the people that see me don't necessarily even want to be there. So we need to get under the hood and really see what it is that motivates them and what I can do to help them.
Thank you. Professor Adrian, do you have anything that you would like to add to that in terms of the focus on?
So in relation to the numbers, I mean, the numbers are important. We can't ignore them, of course, because they are related to the long-term health. But it's how you communicate those numbers is what's important. And this is why I always say it is important at the beginning to at least talk about what is important for the patient, and then you tackle the numbers. And sometimes we don't reach to tackling the numbers because there's a much bigger problem to tackle. So this is why I say that to some extent the consultation has to be led by the patient. I'm not saying that the healthcare professional will not be doing anything. Of course, we go through everything, but it differs from person to person. There's a huge amount of difference. At least in my clinic, I find huge differences between people. So you adjust your consultation style according to your patient, and once you know them, you know what to do because you've known them. You talk for 10 seconds about their holiday. That breaks the ice and makes them feel at ease, and then you go on. So the numbers are important, but it's how you communicate it is the main issue.
Thank you. Rose, do you have anything that you'd like to add?
Yeah, I think we often miss out the really important thing about numbers and the way that clinic works. So numbers are an outcome. Numbers tell us about behaviour. And that's what we really need to focus on in clinic, because we know if somebody's got a very high HbA1c, their behaviour might be very different to somebody with a lower HbA1c. And so often when we only focus on these numbers, and people with diabetes do this as well, I see this all the time, that they criticise themselves because their blood glucose is a 12 or a 14, or their time in range is not the percentage that they want it to be at. Those are outcomes. And we can't control outcomes. We know there's more than 40 factors that affect blood glucose. And so it's thinking about those behaviours, and the behaviours that we can control, and the behaviours and the things that impact blood glucose that we can't control. So can you modify things like thinking about the food that you're eating? Yes. Can you think about making sure you're always changing your insulin needles? Yes. You're checking for lumps? Yes. If all of those behaviours that we know are involved with diabetes management are being ticked off, that will always give us the better numbers. So it's thinking about the behaviour, and it's something really important to emphasise that numbers are an outcome of behaviour. Yes, they tell us what's going on to a degree, but until we start drilling into that behaviour and what a person with diabetes is doing, they will only be a part of a very big puzzle.
Thank you so much. So there's no way for me to seamlessly segue into this, unfortunately, but Mark, this felt like a very important question that has come through for you, which is, someone has written, I've been type 1 for 30 years and I've never seen or spoken to a dietitian. Do I have the right to ask for an appointment?
100% yes.
Yeah.
And actually, as part of the education programs, a dietitian for teaching about type 1 diabetes and type 2 diabetes, the dietitian should be attached to those programs. You can revisit those programs anytime you want, ask your GP for a referral, or if you're under a specialist team, ask them for a referral. Often with the specialist teams, a dietitian is part of the package. So all you need to do is ask the question. But yes, can't emphasize enough, you are entitled.
Great, thank you so much. We are reaching the end of our discussion. I can't believe how quickly that has gone, and I just wanted to thank everyone who has been part of this. Thank you, Daniel, for your contribution this evening. But we're going to retain the majority of our panelists, and for our final session, we can welcome back Dr. Emma Wilmot. And for those of you who are watching, we will try to answer as many of your questions as we can. And the rest of the evening will be about us specifically answering whatever questions that you have. So please do feel free to put them in the chat box, and don't forget that you can also take part in the polls that are also running. So welcome back, Emma. Lovely to see you again. I'm just going to go directly into a question that has come for you specifically. If you would like to feel special about that. So someone has said, how do you access new technology or know what technology is available? Should we have to ask about this, or should we be getting told about what's out there?
So that's a tricky one. I guess it depends on whether this is something that's available through the NHS. So for example, in March 22, NICE have recommended that people with type 1 diabetes should have access to real-time CGM that meets their individual needs. So that should certainly be something that's getting discussed in clinic. But the reality is that actually some places implement that policy more quickly than others, and that might determine whether or not those conversations are happening in clinic. There are lots of new technologies coming through all the time. So if it's ones that aren't necessarily available through the NHS, the healthcare professional might not feel as comfortable discussing it. And actually, it's amazing how many people. So for example, when Freestyle Libre first came out, Ramsey and I would have been in clinic having these people coming into clinic and saying to us, look at this is amazing, this is life-changing. And we actually learned so much about that technology from people who were going out, purchasing it for themselves and coming back and telling us how positive it was. So it depends on what kind of technology and where it is. But now certainly for people with type 1 diabetes, real-time CGM should be the standard of care. For people with type 2 diabetes, access is a lot more patchy and a lot more difficult. But, Ramsey, myself, others across the world are doing research trials to try and understand and describe the benefits. And as I said earlier, I suspect that eventually we'll look back on the fact that we asked people to finger prick multiple times and just think how barbaric that was, given there's different ways of doing it that are much easier now.
Thank you so much. Ramsey, we've had a question that's come in, speaking of research, which is, do you know if there is any research going on into female hormones and diabetes control?
So there's some research in the past as well, and there are studies into fluctuations. There are studies into female hormones and diabetes. I don't know whether there is anything. It's not an area that I follow very closely. So I don't know whether there's anything new happening in this area, but there's certainly quite a bit of research that happened in the past.
Okay, thank you. I'm just going to piggyback a very tiny question. It's not actually a tiny question at all, off the back of just to ask you from a viewer who said, I'm 88 and I use insulin through multiple injections during the day. I've been self-funding Libre 2, which has made a big difference to my quality of life as a disabled diabetic. What are the current NICE recommendations regarding free subscription provision for someone like me?
So if we're talking about somebody with type 1 or type 2, I mean, even if this type 2 on multiple daily injections, then according to the NICE guidance, this person qualifies. Now, we have our own guidance in Leeds, which is in line with the NICE guidance, and we are starting to prescribe it in type 2 patients who would qualify. And because we do a lot of research studies, we can see that some people benefiting from Libre or any other CGM for that matter. And then I sometimes try to make a case that, this person benefited in terms of either glycemia or even quality of life measures can improve drastically. And then with some discussion with the GPs, and then we managed to get the sensor for some people. So I think if somebody is on multiple daily injections of insulin, there's a very good case. And yes, I do start people. I mean, I have actually started somebody in their age group very recently, just a couple of months ago, who's done incredibly well on the device.
Great, thank you. Mark, a question has come in for you, which is, person has written, I was diagnosed type 1 diabetic in 1985, about 13 years ago, but was also diagnosed with celiac disease. Do you have any recommendations of forums where they can meet people with both conditions?
Now, that is a question, and actually I might have to rely on some of my co-panelists here.
Yeah.
I mean, always Facebook groups. In Southampton, for example, we have one called Sugar Buddies, and generally speaking, where there's autoimmune disease like type 1 diabetes, there'll be a certain percentage of patients that also suffer or have to manage, I should say, things like celiac disease. So often you end up with a lot of crossover, and vice versa. There will be societies like Celiac UK, I think it's called, Diabetes UK. So the forums and the bodies are available out there, but other people in the group might have a bit more specific knowledge about specific societies. I'm not sure. I'm not aware myself of any that cover both specifically.
Yeah. Oh, that's great. I think that's a very good starting point. Mark, just a second question for you. This person has written in, I'm a type 1 diabetic, and I have noticed that if I go for a day or two with no carbohydrates at all, and with a little insulin, my blood sugars remain stable and easily controlled. Can I live with no carbs without losing weight? My BMI is currently normal or ideal.
Mm-hmm. Difficult one to answer because there's a lot of ifs, buts, and maybes. Obviously, if we go low carb, we might be removing 1 or 2 major food groups from our diet. So that can be a lot of calories. But of course, if you're just eating less, then you're probably going to be hungry. So you often find that people replace that with the other food groups, typically protein-based foods, meat, fish, eggs, nuts, seeds. So actually you end up balancing out. So snapshot answer, yes, you can do it without losing weight, but often we do find that low carb can be quite an effective way to shift a few pounds. But actually this opens up a wider question really, because of course when it comes to diabetes care and even weight loss as well, we can kind of get the blinkers on a little bit about glucose control, just weight loss, and looking at specific management strategies to do that, which is typically low carb. And of course that can work for people, and HbA1cs and glucose levels are very important, but at the same time it can be at the expense of other food groups, nutritional balance, things like fiber, for example. Fiber is probably, if there was a superfood in our diet, it is fiber. And if we're cutting out major food groups like carbohydrates, vegetables, fruits, the good carbs, I should say, because there are certainly worse carbs for you, the granaries, the whole grains, much higher fiber content, much more nutritionally complete. Actually, what we can find is we start to increase the risk of things like bacterial overgrowth, bowel conditions, and in some instances, in extreme cases, bowel cancers. And we find that people that have a high fiber intake actually have a reduction in the risk of cardiovascular disease, type 2 diabetes, obesity, and the list goes on and on and on. So often we find that there is a happy middle ground between the two, and it doesn't have to be operating at the extreme ends of either spectrum. But I take the point, yes, you can do it, and it can be a nice way to level out the glucose levels, and it doesn't instantly result in weight loss.
Okay, great. Thank you so much. And a very compelling case for a lot of fiber there. So thank you for that. Emma, we've had a question that's come through for you, which is, what do you think the initial training and ongoing training do diabetic nurses receive?
Oh wow, that's a tricky one to answer. I would say the answer is that it honestly varies hugely across the country and across even each locality, and it depends primarily where they're working. If it's a specialist nurse working in secondary care, then we'd expect those people to be trained in type 1 diabetes. They should be trained to deliver Daphne, for example, have a good idea about how to support people on multiple daily injections. As the technology is moving on, we'd expect them to know things like CGM, closed loops, etc., in a bit more detail. But if it's a diabetes nurse who works primarily in primary care, doing annual reviews and supporting primarily people with type 2 diabetes, then the skill set would need to align with that. But the reality is we've got some nurses out there that have got decades of experience, who've been there, done it, and are, know everything inside out. We've got other people at the start of their training journey. And I think bear that in mind when you're interacting with healthcare professionals, that they may be at the start of that journey and feeling a bit nervous and worried about seeing you with your diabetes, because fundamentally the person with diabetes is the expert in their own condition, and some healthcare professionals are 100% confident having conversations and feeling expert, and others at the beginning of the journey and feel nervous and might need your support to understand what happens. And I often, both Ramsey and I are involved in training healthcare professionals up and down the country. And what I often say to them is, if you feel out your depth in a consultation, turn to the person with diabetes and say, walk me through this, because we have, as healthcare professionals, we have got so much to learn from people living with diabetes.
Great, thank you. And also, I guess, to your point that you made at the start of the event, which is that if for whatever reason you don't feel like you're getting the right kind of care, or you're gelling with your healthcare professional, you can request that person to be changed potentially. Yeah. So very quickly, just before I move on, we've had another question that's come in for you, Emma, which is it true that the revised NICE guidance is likely to make access to tech easier in the coming months?
So it depends whether this relates to continuous glucose monitoring or hybrid closed loop. So in 2022, NICE updated their guidance to say that people with type 1 diabetes should have a choice of CGM. And across the board, I believe that more than 3/4 of people living with type 1 diabetes have access to some form of continuous glucose monitoring. The next challenge, I guess, is the more expensive, potentially, forms of CGM that combine with a pump to form a closed loop. And actually, we were waiting next month for more recommendations from NICE to come out about access to hybrid closed loop technology, which will be something we call a technology appraisal, which means that it's mandated to be delivered. So watch this space. If you're not on Twitter, you'll see lots about this on Twitter next month. But we're waiting for the final recommendations to come out, and then we need to see what the implementation plan is around that. But that's another exciting development. And again, if you've got diabetes, you're on here and you're not engaged in social media, it is a go-to place for example, in Derby, we've got a peer support group with over 800 people on it that all live in Derby with type 1 diabetes. And a lot of them find that in between their appointments, it's a great way to keep in touch with what's happening, and they can discuss. And also, just if you're having a bad day, somewhere to log into and say, I'm frustrated about this, and being able to use other people with diabetes as your sounding board. So yes, social media is the place to go for all the latest developments. It's moving so fast, Ramsey and I even struggle to keep up. It's changing all the time.
Thank you. Ramsey, we've had a question that's come in from someone who has said, my diabetic nurse is not insulin trained and will not give me any advice on insulin. It's hard to get an appointment with the consultant, and I have CKD with no contact from the kidney team. Do you have any guidance or ideas?
Yeah, I mean, this can be an issue in some places, and I think the only way to tackle it is to be persistent and say, I need to be seen, because some people are not comfortable with insulin, which is fair enough in managing insulin, but then that person needs advice, and don't be afraid of asking and demanding, because it's your right. So, and particularly if I heard correctly that there's an issue with CKD as well. So this needs to be sorted. So please just, and if you have no joy in one place, try another place, because this is just unacceptable not to have the access.
Thank you. Rose, I have a bumper question for you. A sort of a thread or a theme that seems to be running through today's event is people feeling alone, in terms of how they are mentally, especially coping with their diabetes as well. And we heard Jasmine at the beginning, who was saying that, that can be difficult, for example, when you're seeing a healthcare consultant maybe once a year. Someone has asked, do you have any tips or advice on how to help them cope with the burnout that they're feeling about managing their diabetes, and also if there is any way, if that does feed into how you can feel less isolated about it, that would be very helpful.
Yeah, I think one of the main things that I think multiple people have spoken about this evening is peer support. So being in a group with other people with diabetes who get it is incredibly important. And that has a really protective effect on both how you feel and your social interactions, but also your mental health. Our brains enjoy being in groups. We are social creatures. So getting into some peer support, whether that's in person, whether that's meeting up with one friend, whether that's being in a group online, all of these things are really important. For people who are experiencing burnout, I think the really useful things to think about is when I work with people with burnout, so often people are stuck in this cycle of perfectionism and guilt that then leads to burnout. So although it feels a bit counterintuitive, sometimes the best thing to do is to almost start again from scratch, because a lot of the time people are putting huge pressure on themselves to be completely perfect all of the time, which we know is not possible. You are a human with a life that is stressful and a brain that is tricky a lot of the time. So trying to take things step by step. So working out what's one thing that you can do today, what's one step that you can take in the right direction, and getting stable at just that one step, and then building up and then building up. So slowing down, trying to take some of the pressure off and talk to the people around you. It's so important. So whether that's online, whether that's in person, reaching out and asking for the support that you need is a really fundamental aspect of looking after yourself when you live with diabetes.
Thank you. We've also had another question that's come in for you, which is, so I'm gonna read the question, but I'm gonna tag something on to the end of it, which is, so
Okay.
someone's asked how they can stay positive after a bad day of managing their diabetes. And I think, given the theme of what we're talking about, also, I think how you retain a positive mindset or a sense of perspective. Let's say if you've had a bad experience with your healthcare team and you're sort of struggling to see how things can get better.
So I think one of the things to really remember is that diabetes is a real soul sucker of a condition a lot of the time, that sometimes you put in so much work and you still don't get the results that you hoped or expected to get. It's one of those conditions that is really good at helping people to feel judged and to feel criticized. So people with diabetes really need to be thinking about that resilience a lot of the time, building up that resilience, because this is a condition that chips away at your psychological health. So I think if you have had a bad day with the blood glucose, where for whatever reason what you've been doing hasn't been working, just trying to remember, okay, have I made it through today? Because sometimes just being alive at the end of the day can feel like a really big achievement. And then working up from there. A lot of the time when we get stuck into that self-criticism, it's something that our brains do very naturally because that's what they're programmed to do. But it's not particularly helpful. It doesn't suddenly make your glucose behave. Your blood glucose doesn't hear you being mean to yourself and go, oh, I'll get back and I'll be a 7. That's not how these things work. So remembering sometimes when you get stuck into that self-criticism loop, just asking yourself, actually, does this help me? Does this change anything? And if the answer is no, then you've got permission to focus on something else. Really basic things like self-compassion are so important when you're living with any long-term condition, but diabetes in particular. So thinking about, well, if this was a friend going through this, if I was here with someone else who was really struggling, what would I say to them? How would I act around them? So taking that time to be kind to yourself, to soothe yourself, and to be able to say, okay, today's been rubbish and it's okay to feel sad. It's okay to feel upset. We'll start again tomorrow. To be able to pick yourself up from the floor and to be kind to yourself is so important.
Thank you so much. Mark, we've had a question that's come in that's quite diet specific for you, which is, do you have any advice if you are unable to eat gluten, alliums, pulses, all the remaining foods seem unhealthy for diabetes, and so many healthier gluten-free foods can't be tolerated by me?
Yeah, and this is always a challenge, and we'll work with quite a lot of patients that will have varying needs. And actually, I think that applies to the wider team as well. You know, we specialize in diabetes, but this patient might come in with renal troubles or liver problems, and actually we're not necessarily the specialist in that, and so we need some cross working to sort of upskill ourselves and lean on our colleagues to help. So for example, in this instance, there would be a gastro or an allergy dietitian that would be able to also help. So generally speaking, when I am presented with queries like this, there's usually some foods that person can tolerate. and often trying to get to the bottom of it is step one. So, and this ties in with actually one of the earlier questions that I was asked, which I don't think I actually touched upon. Coming to the appointment with as much information as possible, food, symptom diaries can help to start identifying what works for you, what doesn't work for you. And then it allows me to then specifically start working with you to piece together what actually might be a reasonable diet for you to follow to hopefully tick box both conditions. And I think it's also trying not to put too much pressure on yourself, because sometimes the best we can do is maybe achieve a good average for both, but it doesn't have to be perfection. We're not asking for perfection. And Rose was just talking about that, and I couldn't subscribe to that more. And also, if you are struggling with those other elements of the diet, and I'd be on it, and in this instance perhaps I couldn't help you, then there are colleagues that I can reach out to, or you can ask for a referral to someone that does specialize in it, and then bring that information to the appointment to me, and we can then start to, you know, unpick it a little bit more.
Thank you. Ramsey, I've got a couple of questions for you. And the first one that I'm going to ask, because I think it was touched upon by Ken, who was in the very first video, talking about he's got type 2 diabetes and talking about using Libre too. And he said that we've had someone who's written in a question, which is, how do you react to the latest comments from doctors saying Libre 2 should not be used by type 2 diabetics or the general population?
Yes. So let me just start by saying something that my patients told me over and over again. When they get Libre or any CGM, one sentence that they keep saying, now we know what's happening with our diabetes. And they know what that daily activity is doing in terms of exercise, or what they are eating, what it's doing to their sugar. So there's a huge amount of information that is gained by the patient, and of course the healthcare professional as well. So in terms of the use of continuous glucose monitoring in type 2 diabetes, as Emma said, this will become the norm in a few years' time. I think, you know, we can't stop that change. So it will happen. Now, one thing we need to appreciate, that the NHS has got limited resources and we have to prioritize. I think we are very lucky to have the NHS, really lucky, because not many countries have got that. But we have to be careful about how we manage the funds. And this is why we are doing it in a step-by-step approach. But I think we will get there. I think type 2 diabetes patients are entitled to this, but we will need to prioritize, because we can't just give it to everybody at this stage. But will it happen? Absolutely. I have no doubt in my mind. We are using it for type 2, but as I said, we are prioritizing, and maybe intermittent use will be the answer as well in the future. So we will see. So I feel sad I can't give it to all of my patients, but we are working on it really hard behind the scenes to accelerate the process and spread it out to as many type 2s as we can.
Great, thank you so much. I can't believe how quickly the time has gone. We are sort of reaching the end of our session, and I wanted to ask each of you a quick fire question with the emphasis on quick, which is, if there is a final thought that you could leave people with, whether that is looking at things from the sort of the healthcare professional side of things, or people who are accessing that. Is there one thing that you would advise people to do, if there was sort of one thing that they could do in their kind of short-term future, or consider incorporating into how they care for patients? What is the one thing that you would suggest that they would do? Mark, I'm going to start with you.
Sorry, Pona, do you mean from the healthcare side of things or from the patient side of things?
It could be either. It could be either. You could do both, you know, if you want to be a teacher's pet. So it really depends what you would like.
Well, I think from the patient side of things, I think with the devices that are available, particularly the Libre, what it gives patients is a higher element of engagement. So the more you can engage with the technology, the more you can engage as a dietitian with your diet, writing it down, touching it, feeling it. That's more information for me to work with, but also put you in a better frame of mind to then actually improve whatever it is or whatever goal you're trying to reach from a healthcare perspective. Again, I've said it, I'm saying it to death tonight, but I think really I can't stress enough trying to get yourself onto those counseling courses and upskilling ourselves to structured consultations, because it is a skill. You know, we can't just rely on personality to do it. Sometimes you need to engage in those non-medical, non-clinical skills that then actually reflect better on the patients and just make things flow so much better.
Lovely, thank you. And Ramsey, very quickly.
I'm struggling with this one, but I would say close relationship between patients and healthcare professionals, and voice your views and voice your concerns all the time. That what I would say.
Thank you. And Emma?
Yeah, just noticing some of the comments that came in towards the end. If you feel that you meet the criteria for technology and that you're not being offered it, fight back. And if you are struggling, Diabetes UK have got a helpline. They're on a massive campaign to support access to technology. So contact Diabetes UK and they'll support you with it.
Thank you so much. And Rose, very, very, very quickly.
Remember, you're a human, and for healthcare professionals, remember you're a human working with a human.
That is a perfect note to finish on. And sadly, our event has come to an end. Thank you once again to all of our contributors and experts who joined us live for this Freestyle Connect event and in all the videos that we shared. And our audience, as always, you're just amazing. You know, thank you for sharing your vulnerabilities, your thoughts, your questions. And we obviously hope that you have enjoyed the event. It's been great to see people living with diabetes and their healthcare professionals, you know, how both sides can learn from each other and support each other. So we hope that you've learned something that you can maybe take away with you, that it will help you work in partnership with your healthcare team and hopefully just build the best relationship that works for you. So see you next time and good night.